Hello again. This morning I'm going to talk about narcotics. I went ahead and did a short chapter on narcotics because it's such an important subject. I think it's important to recognize that we have limited ability to control patients' pain with the medications we have. They certainly work a lot better in the short term than the long term. Unfortunately, in the long term, the narcotics in particular, uh, the effect of them tends to wear off. There becomes tolerance to the drug, but the toxicity does not change. And so, in particularly, respiratory depression is one of the main issues. So, a number of overdoses, um, they may be inadvertent, and used to be, and still I think are close to 100,000 deaths per year from narcotic overdose, whether that's prescription or non-prescription, are most likely related to respiratory depression. So the scenario is, in particularly the person who is addicted to narcotics, and sometimes the patient, but the patient is on a controlled amount of medication, but they may not take that particular prescription as it's supposed to be taken. So what will happen is there may be euphoria in some patients, or euphoric effect with the narcotics, and so the tolerance of the drug is such that they need to take more narcotic to get the same euphoric effect. So as they increase the dose of the narcotic, the dose that causes respiratory depression, that is the ability to breathe, doesn't change. So they reach that toxic level where they quit breathing and simply die. So this has become a huge problem, and there have been articles written and steps taken by the government to try and avoid this situation. One thing that did happen as regards to physicians is the government became more, controlling, and has special websites set up to where you can check the patient. Are they getting multiple prescriptions from other doctors, or what's going on with that? Also, there were increased requirements for physicians to undergo further courses and demonstrate competency in narcotic prescription. The DEA does monitor certain narcotic prescriptions on physicians. Some of them are not monitored as closely as others, but they are all monitored. So there were steps taken to try and cut down on these overdoses, and they may have been helpful. Keep in mind, this is a huge problem. In terms of pharmacology, the narcotics will have a side effect of sedation, bloating, constipation, in some cases abdominal pain. There may or may not be a euphoric effect with the drug. The pain relief they provide may or may not be there. Certainly it may only be partially successful. There are some types of pain that are thought not to be responsive to narcotics, such as neuropathic pain, like back pain, pinched nerve types of things are not thought to be very responsive to narcotic medications. Now, when I say narcotics, I'm talking about drugs like fentanyl, drugs like Demerol, morphine. There are oral morphine types of medication now, codeine, tramadol, hydrocodone, Percocet, Percodan. So there's a whole armload or laundry list of these types of medications, and they can be quite harmful. Now, they can also be beneficial and life saving as well. And so, if you're in the hospital and you're going through a surgery, those pain medications can be really, really helpful. And in the short term, it's unlikely that they will cause addiction. The concern has become, and a lot of people feel like the patient gets addicted if they get a prescription for pain medicine, they go home, they're on it for a long period of time, perhaps a couple of weeks after surgery, they might have be on such a pain medication, and patients then say they become addicted. Most people that are on chronic narcotic medication will have addiction issues, and they may well be addicted to the medicine. Um, there's not much concern for that if the patient is not going to survive a long period of time. They have cancer or some other issue, then we don't worry too much about that. Now, another side effect of the narcotics can make patients non-functional. And so you have these pain clinics that are set up, usually by anesthesia doctors, and they are monitoring the patient and seeing them in the clinic, but they may not be aware of everything that goes on. So I can remember seeing patients in the office who were non-functional. They'd be walking into walls, very sedated, couldn't do anything because they were so sedated. And I don't think the pain doctor was aware of this, because that's not something the patient might reveal to them when they come in for their appointment. So at any rate, I would call the pain doctor and they would cut back on their pain medicine. And then, of course, the patient would complain about that, but it's better than having the patient fall down and break or hip or anything like that, or suffer some other type of injury. So at any rate, that's important to keep in mind. Now, there are people, and this is why physicians really don't like to deal with this, is that there are a lot of people who pretend to be in pain so they can acquire narcotics, either for selling them or to get euphoric effect and continue an addiction problem. So there always, it seems like there's always some patient trying to trick the doctor. May see them in the emergency room or elsewhere. And doctors are very sensitive to this because they run into this fairly frequently. So this has become sort of the bane of physician practice, unfortunately. I remember one patient when I was in the military who kept saying she had kidney stones and wanted to stay in the hospital, and she would produce these little stones, and of course they didn't look anything like kidney stones. They were like little pebbles and stones with jagged edges and things you might find in gravel out on the street or in a playground or somewhere like that. So eventually we had to search her room and confront her and move her out of the hospital. But people will try to trick you into giving them more medication. There is a syndrome that's called opioid hyperalgesic syndrome, which is a syndrome in some patients where their pain that they have just becomes overwhelming, even though they're on narcotic medicine. And this is particularly problematic, but should they have to be taken off of their medicine and put back on something else, or put back on their medicine in lower doses, or it has to be properly handled. Something to be aware of. Also, you should be aware of that physicians get death threats having to do with narcotics. There's one article that came out in the Roanoke Times indicating that 2/3, I believe, of pain doctors had at least one death threat per year that they were getting. There was an incident in Tulsa, Oklahoma in 2022 where a patient came in and shot and killed 2 doctors and 1 receptionist after he had had surgery, claiming that the surgeon had not given him enough pain medication after surgery. And that kind of brings into focus what our guidelines are. And the guidelines are to be very careful and wean the patient fairly quickly off of narcotic medication after surgery so they don't get addicted. So I'm sure that was the aim of that position. And this particular patient came in and decided to kill professionals over it. So a particularly tragic event involved, and I'm sure and I know there are many deaths having to do with narcotic medication. So it is a subject I wanted to address, and I'll just stop at this point. Thank you.